Hello and welcome to this week's episode of Two Southern Nurses, Doses of Wit and Wisdom, brought to you by Plain Speak Productions. Here are your hosts, Donna Parker and Tammy Clark.
Hello, and thank you for stopping by to visit Two Southern Nurses, Doses of Wit and Wisdom. My name is Donna Parker. I'm a registered nurse, a certified case manager, and I'm here today with my friend, peer, and nurse extraordinaire, Tammy Clark.
And we want to introduce ourselves, why we started the podcast, and what we want to accomplish through the podcast. So again, my name is Donna Parker. I am the business owner of Plain Speak Nurse. I provide workers' compensation services. I provide test observer services in the state of Tennessee for nursing assistants that are seeking certification. I have been a nurse since 1993, and before that was a caregiver in the home, and feel like a lot of experience. I have a lot of experience to share and tips and tricks that will help the upcoming nurses. Maybe you've been in the field for a while. Maybe you're a caregiver of a loved one and you need to know how to do things safely in the home. So we've got lots of information to offer. I'll let Tammy introduce herself, and then we'll kind of get into more of what we're going to be doing in the podcast.
Tammy Clark. I'm an RN, BSN. I started nursing school, I think it was 89. In 89, then you could complete your nursing 101 and become a CNA. You could work as a CNA. Of course, times have changed, right? But I was a CNA for 3 years. I did oncology as a CNA. And a women's center, postpartum, labor and delivery, women's surgery, and then got my LPN, worked for a couple of years, got my RN, same as you, became a LPN in 91, a RN in 93, fell in love is why I took that sharp right from pre-med into nursing, because I had to have a job because I was going to get married.
Right.
And, it was a great reason to change. And it has been so much more rewarding, I feel. Because I think nursing gives us so many more choices. If I had done pre-med, it would have been one way street, right?
Right.
The straight and narrow. But, for me, nursing has been acute areas, pediatrics. Like I said, my love has always been postpartum, labor and delivery. Got to look at a lot of birthing centers. Love that stuff. And then I wound up in acute physical rehabilitation. Why, right? It's
Another
just
turn.
It's just opportunities that are at the moment, and at that time, a new facility in Chattanooga was opening up, brand new facility, physical rehabilitation. So I thought, hey, a new hospital.
Mm-hmm.
A new hospital. We'll have plenty of help.
Everything.
Yes, and we did, and it was great for a minute. No, it was good for a long time. But yes, I stayed in physical rehabilitation for 26 years. In that process, though, I got a lot of specialized care, a stroke unit, spinal cord injury unit, traumatic brain injury unit. We even had pediatric neuro for 5 years. So it kind of brought me to this place, of 33 years later experience, and getting a taste of everything, administration, management in the process. So teaching, absolutely.
LPN programs and
like we're talking about now, our foundations, and nursing has a foundation, and every nurse that comes through pretty much molds her own foundation on what is it based on? So for us, that's what we want to share, and that's what we want to say. If you have that firm foundation, whatever you choose to build it on, it will last you a lifetime. There's no sense in being discouraged. Any job you go to, any job you go to, you can be discouraged, and being happy with this part or that boss, or so. Along the way, just realize it's still a business. Yes, you're getting paid to do that. When I started teaching in the latter part of my career, I started teaching, right? And it was like a month later, and I was like, I get paid to do this.
And I like it.
And I can't believe that, because my years of experience just, it did the work for me, because it was, open your mouth and the information comes out, whatever subject you're teaching. Right. So, and teaching is experiences. So I don't think I could have been a teacher without everything else.
Right.
Because you're going to have good experiences. I had bad experience as a clinical coordinator. I had, oncology was not you have to find that fit for yourself.
Right.
But nursing has, I think, made me that stronger person.
Right.
In your family and in life. I think without it, I would not have been the person I am, obviously. So
right. And talking experience, you have labor and delivery, you have pediatrics.
Mm-hmm.
I am on the opposite. I don't have those specialties. I worked burn and trauma ICU, open heart ICU.
Yeah, I
dialysis.
I hadn't been there. Yeah.
Right. Dialysis, acute rehab, long-term care, hospice, home health. So together we have lots of experience.
I think we've covered many
case
areas.
Management, workers' comp, special needs. Of course, my sister had epilepsy and cerebral palsy.
Mm-hmm.
So together we can cover every level of nursing. We've done, between the two of us, I've worked at insurance companies, I've worked in utilization review. So we see it from a patient perspective.
Mm-hmm.
We see it from a business perspective. And we also see it from a professional perspective, in that we can take those things into consideration and look at our patients as a whole. And I think sometimes when nurses just focus on one area, they tend to focus on that diagnosis or that problem that they're having right now, and they don't really look at the whole picture.
Mm-hmm.
And I think bringing in the experience and teaching observation and how that things are all connected.
Yes.
You don't just have a traumatic brain injury, right? That affects everything. And it affects not just that patient, but their support system, right? Their caregivers, their mother, father, whatever roles that they have, their income, right?
Right.
So many things that we can bring light to that. We can bring tips and tricks. We have community resources. We can direct you to state, federal resources. We can talk about utilizing the benefits that you have. Okay, so we're paying all this crazy money for insurance, but are you using all the benefits that are available to you? So we're anticipating many, many episodes of the Daily Dose, and we want to encourage you to reach out to us if there's something that you're having trouble with, if you need resources, if you need to vent. Maybe you need to write us a letter and say, look, this is my story, this is what's happened. I'm worried about, I'm thinking about, hey, we'll provide contact information. We have several products developed or in the development process of developing that we want to share with you in the community, and bring family members, join us on the podcast. We're wanting to go live at least once a month, right? And interact, and where we can address things in real time. Yeah.
We want to guide you, because what's happening today, I think, in nursing a lot of times is it's not, it kind of does mirror what we went through. There's been a shortage for most of
Our careers.
my nursing career.
Yeah. Yeah.
And yes, they're still, it never stopped.
Right.
I think back when I was in school, the 90s, I think they were saying at that time that we would have a nursing shortage through 2050.
Right.
Right? And we're at 25.
Right.
So if that's the truth,
That's right.
we got 25 more years, right?
Right.
No, but,
And I think COVID affected the nursing perspective because let me tell you, that was trials and tribulations right there. Either, you had to do things you never thought about doing in nursing to make it safe and make sure everybody was taken care of.
Right.
The impact that it had on the mental health of the staff, the mental health of the patients and the family, that was not a good time to come into nursing because it was not giving you the fair opportunity and to see what was available. Everything was a crisis. We were putting out fires everywhere.
Yes.
And so we understand there's negatives. There's going to be negatives wherever you work, right?
Mm-hmm.
We want to teach you how to cope with those negatives, coping skills, and also self-care, because we've both discussed self-care as nursing and supporting each other. We tend not to do that. We're caregivers. We give and we support other people, and sometimes we have to remind each other, hey, let's take some us time. Let's take some me time, some adult time, and non-nursing time to relieve and vent and release ourselves.
Yeah.
So we definitely want to talk about the positives. We've shared many a tears with families. We want
and with each other.
Right? We're human, and we take care of humans. This is not an assembly line job. This is not. There are a number of their diagnoses. This is your friends, family, community members, and we've got to bring the people in and keep the people that we have that have the heart and love of that relationship and want to feed that relationship. And we can teach you how to do those things. Be on the lookout for upcoming videos on basic skills, activities of daily living, how to do that safely in a facility or at home. We want to talk about those things because we're all an accident away from needing help, right? We're all an accident away from a disability that those things aren't planned for. And so we want to look at nursing in the broadest spectrum, helping you across the lifespan, wherever you are in that journey. We can help you, and we want you to be here and come back and see us and give us feedback.
Absolutely. And that's the, I think some nurses are going to, hear the podcast, see the podcast and say, what do they know about what's going on today?
Right.
But
I just left the bedside.
Right. Well, I just left teaching.
Right.
Teaching nursing school, teaching CNA programs. So it's nursing, it's healthcare regardless.
Yeah. And we're still in the midst of seeing students coming out from schools from Middle Tennessee to East Tennessee, from the Kentucky border to the Georgia border, and they're still across the board having issues with basic nursing skills.
Right.
Are the programs not long enough? Are the programs not directed correctly? Are the teachers not at the bedside anymore and don't know the procedures? Are the students figuring it's easier than it really is?
Right.
Those are things that we're seeing. And when you have a loved one in that bed and you see things going on that's not in the best interest of that loved one, whether you're putting them at risk of a fall, a bed sore, dehydration, skin breakdown, comfort, right? Dignity. We want to talk about all those things and get you to look and to know and be confident in the skills that you have. Yeah. You don't have to be a nursing age student to benefit from these videos that we're making, right? These are we're going to talk about adaptations in the home. We're going to talk about in the facility. Maybe you've seen some other staff members that have picked up some bad habits over the years, right? Or they're kind of lax in protocol. We talk about the reason and the whys that we do the things we do the way that we do them, because we always want to keep the patient safe, and we always want to decrease chance of infection. Yeah. We always want to make them as independent as possible, and talk about integrity and take into consideration their religion and their beliefs. And each person is different, right? We may have different hair color, different style, our body functions, but individually, we're all individuals, and we cannot lump folks into a category or a stereotype, or let our beliefs impact the care that they need, and let their beliefs impact the care that we provide. We can't do that as nursing, right?
No.
We have to love everybody and support everybody in their journey. And if you have problems with that, then we need to talk about how to resolve those problems. If that patient is not a fit for you, then your manager, your supervisor will help you change that assignment, right? Because we want the best outcomes.
Absolutely. You're always going to have, in any workforce, you're going to have personality conflicts with coworkers. But as caregivers, every door that we knock on and open, you're going to have a patient with different signs and symptoms, with different emotional stresses, spiritual stresses, physical, mental, right? Holistic.
We don't know what all's going on.
We do not.
Right.
So when you walk into that room, you can't put them into a box.
Yeah.
Oh, it matches the other 20 strokes that are on this unit. Every person is going to have their own individual signs and symptoms and personal stressors and family stress
and abilities, right?
Yes.
Were they healthy before the stroke? Or are they not so healthy and or they have more comorbidities,
right? That
is impacting their healing, right?
That's it.
So each one, care planning, figure it out, paying attention to signs and side effects. Are they having side effects from their medication? This observation assessment is an ongoing process, whether you're an aide, whether you're an LPN, an RN, a master's, a doctor, a psychiatrist, a nutritionist, whatever you are in the healthcare field, it takes a tribe, right? It takes a tribe to raise kids. It takes a tribe with the elderly. It takes a tribe with people that need help. And they're not there because they want to be there. I mean, people say, oh, I'm ready for a heart attack today. Let's go to the ER.
Right.
That just don't happen, folks.
I don't know. I think they do that on Thanksgiving.
Right. Hey, yeah. Because I don't want to go to right. I've ever ate.
No, that's bad. That's bad. I should say stuff like that.
But we got to pay attention to those things and be aware and communicate, right? So it doesn't do any good if you're a nursing assistant and you're in here and this patient's been incontinent and they've got little rabbit poop. And so they're constipated, right? But if you don't talk to the nurse,
right,
and say, hey, do they have anything? Or maybe we need some more fiber in their diet, water. If you just keep that to yourself, well, that poor patient's going to be miserable.
That's true.
And we're going to have problems down the road when we just need to communicate, observation, communication, and documentation, right?
That caregiver, that nursing assistant, they are the nurse's eyes and ears. Absolutely. Because what if it is long-term care? Long-term care, you got one nurse and 20 to 40 patients, right?
Right.
So the CNAs may have 10 patients. 8 to 10 patients with the nurse having 20. So if that tells you anything, they're going to be bathing them. So they're seeing the largest organ, the skin. So if they see some redness, that is part of their job is observation.
Yeah.
They don't have to assess and diagnose. No nursing diagnosis, but you have to tell us what you saw.
Yeah.
Explain.
Yeah.
Do that observation and explain it. But what Donna is saying and what you're hearing what Donna is saying is that, again, patient comes first.
Always.
Okay? And what she's talking about, all this stuff, where does it sound like, okay, as a nurse, I'm last. We tend to put ourselves last.
Right.
So we need to promote self-help.
Yep.
Self-help, self-health. And how do we stay nursing healthy?
Right.
If we're not healthy, how can we
take
care
care
for
of
that patient?
Yeah.
Yes, I remember saying, I've give and give and give for them the last 13 hours. Come on. Now I got to go home and feed a baby and a husband. And, they need love.
Yeah.
Right?
Yeah. And
you're like,
housework.
I have nothing left.
Yeah.
I have nothing left. I've give all day. And you get home and your husband's like, what's for dinner? Right?
Right.
Mm-hmm.
Right.
And then you kind of bite your tongue.
Because, that they're waiting for you. They need you.
Yeah, they need you
And
too.
so then our hat switches, right? Then we got to be from nurse to
mother,
partner, wife, husband, whatever we are.
Yeah.
And housekeeper and whatever else.
You got 4 full-time jobs. Okay,
That's it.
That's just how it goes.
And somewhere now you've got to get a few hours of rest,
Right?
And a shower, before you go to bed. And then you get back and you get to go see them again. Hopefully, the next day you're a little more familiar with that patient or your group of folks. You can tell if there's a change, right? Because you've had them the day before, the past 3 days, past 5 days, whatever it is.
Certain areas of nursing, you're going to get to see them every day for a few days,
right? If you're in the ER, that's a whole different bear, right? And that's what do they call it? Organized chaos in the ER.
Organized chaos.
So, and we're going to touch on that. All the different opportunities. Good God Almighty. We could talk about how many different roles and the new upcoming roles that they're realizing nursing is excellent for.
Yeah.
Right.
And how COVID has changed that.
Has changed.
It's added more areas to nursing.
Yeah.
More jobs to nursing. So it made a major shift in the world.
Mm-hmm.
But in nursing, it made a major shift too. But we could focus on negatives. Yeah. But I think the positives is nursing saw how strong they could be.
Yeah.
That I can do anything for this many hours, right? I can do it for 12 hours. Now, I might not can do it for 25 days, but for 12 hours, I can do this.
And healthcare is 24/7, 365. If you're somebody that must have every weekend off, holidays off, your baby's birthdays off, that's not going to happen. Not in the beginning.
Not even in this world today.
Right. 24/7 healthcare.
No. Right.
If you live in one of those cold spots, or like we do, get ice every once in a blue moon, and the roads are shut down, you're going to stay where you're at, take care of them folks.
That's true.
Until your relief comes.
And if no relief comes,
and then you're
going to go sleep for a couple of hours in a
switch out with your
empty
coworkers and shower and do the airplane wash and go on and be there for your patient happily.
Yes.
Right, because they're paying you.
That's right.
And they're not there voluntarily. They're there because they need you.
They need the help.
Right.
They need the care. So care has to continue.
Right.
That wonderful phrase, continuity of care.
Continuity of care.
Right.
And no matter where you're at, no matter what you think you want to go into in nursing, you've got to have the basics.
Yes. Foundation
of
nursing. Yeah.
And so we're going to start with those in the beginning and talk about all that. And then I'd say we've got endless topics.
We do.
Yeah.
We do. Because like you said, you became a nurse in 93. Yeah. I started, like I said, as a CNA, or not really CNA. It's kind of a nurse tech.
Right.
They didn't call it a
CNA. I got my RN,
So I was a nurse tech. You were nurse tech level 1, nurse tech level 2, level 3. But I remember as an LPN, my first job as an LPN was chronic children. So it was kind of like home health, which I've done regular home health, but this was chronic children is what they pretty much call it. They call it family home care.
Okay.
So you would go into the home and care for that one child for 12 hours, whatever. If it was washing bottles and peg tubes and sterilizing catheters in a pot of boiling water, right?
Yeah.
I mean, it was whatever you had to do within that home environment, because remember, that's adaptation too. We have to adapt to the environment we're in, whether it's being in a home with a child with a 9-month-old with a trach, that I'm a nurse, right? I'm not a respiratory therapist. But as a nurse, I had to learn how to clean the trach properly. And I had to change out the trach with him, give him breathing treatments. What if he had a mucus plug? Yes, you got to know how to change that trach out.
That's right. As does the family.
The family, yes.
Because you're only there.
Oh, yeah.
Right? What happened in emergencies or things that happen, maybe a nurse shift got missed. Then that family's there, right?
That's it.
So,
yes.
We're always educators
Yeah.
to peers, to family, to patients.
Well, and for me, going into that home environment, the family taught me.
Yeah.
This is how we do this with him, or her. This is how we we give him the breathing treatment. We change out the trach and So, sometimes the families think they've been taught thoroughly how to care.
Right.
I mean,
right.
As you know, 24/7 at home too.
Yeah, 24/7.
They don't get a break unless they do have a nurse coming into the home. I think respite care has been on the rise. I think we had it then. I just don't think it was utilized as much.
Right.
Yeah.
Right.
But I see respite being utilized much more now.
Right.
So,
and that's another benefit thing that we can talk about is,
absolutely.
Do you know how to find the places in your community that maybe have a scholarship program, or does your insurance pay for that?
Right. And what if they don't pay for it? There's other organizations like what was it called? I think it was called like Sitters Inc. or something like that in the area.
We'll have to do some more research.
Yeah, where they are certified in CPR.
Yeah,
but they may not be certified nursing assistant or nurses, but they can come in and sit with that patient resident in the home,
right,
and give the family that respite time that they need.
I know the PACE program in Hamilton County,
yes,
right?
Yes.
So they have day programs, but
that's true.
To give them, there's some facilities in the area that they can get 3 to 5 day respite stay for the family, whether they're going on vacation or maybe the caregiver at home is ill and can't take care of the family member.
That's true.
And so then they go to a facility, they receive 24/7 care.
Absolutely.
And the family can care for each other.
I remember witnessing that in long-term care. The family would say, believe it or not, we need a vacation.
Yeah.
We're going on vacation.
Yeah.
For 2 weeks. And they would actually check their loved one in the facility. 24/7 care for 2 weeks. They come back and pick them up.
That's right. Because they're, again, taking care of the family unit. That's the mental health.
Mental health.
If you get burned out at home and you're the only caregiver, things are going to go awry. And we don't want it to be to that point. We want you to know how to cope and de-escalate because it doesn't benefit anyone.
And then the elephant in the room, right? Nurse burnout.
Right.
I mean, families that are caring for their loved ones 24/7 due to a trauma, disability, injuries, no different than nurses. Oh, yeah, let me work that overtime. Let me work 7 days a week taking care of the same patients. You're going to feel that burnout. We always recommended that. I think when they came to work at some of the facilities, if you're a new nurse, you're not allowed to work overtime until you have been here X amount of time.
Yeah.
Maybe it's the 3-month period, or 6-week period.
Remember that flustered feeling and that anxiety and how tired you were at the end because there's your heart's pumping and you had 3 codes that day and
That's right.
And right. At the end of that 36-hour stretch, man, you were exhausted.
Yeah. And you're like, why am I so tired? It wasn't, it was physical.
Yeah.
Oh, yeah, but it was mental too.
Yeah.
Mentally draining. Oh, it was spiritual. It was social.
I cried. I snotted.
Absolutely. Yeah. You are providing a socialization for a lot of these patients that are kind of secluded sometimes in long-term care. Thank goodness for the most part, you do have family that visits routinely, but then you have sometimes someone who doesn't receive
Visitors.
So,
That's right.
so as a nurse, as a CNA, as a caregiver calling someone in to sit with that patient, they're the ones is providing the only socialization that patient's going to get.
That's right.
So,
And how important is human touch? Right.
With a nursing assistant, absolutely. A caregiver.
Yeah.
That is all they're going to receive.
That's right.
So think about you opening that door and you're the only person they're going to see that day.
Right.
They are so excited.
Exactly.
They are so happy you're there.
They want to share their stories.
Yeah.
Right.
Yeah. So
they want you to listen.
Think about that. Be the
sunshine.
You have to be.
Yeah.
And yeah, sometimes, you had a bad morning. You had an argument with the husband. The dog died, whatever, right?
Yeah.
And you had a bad day. And, that's what I always taught was when you clock in, you can leave all of that bad stuff at home where it started and come in because you need to provide the positivity for every door you open.
Undistracted.
Absolutely.
And if you can't leave it, then maybe you don't need to be at work that day.
That's it.
Right.
Yeah.
Because nobody's going to benefit if you're not there.
Are they not doing mental health days now?
I believe so.
I've heard that phrase.
From the facility. I've heard the phrase.
Mental health days.
Yeah.
You are allotted mental health days per month.
Yeah.
Or
you need to plan those. You can't just call in at 6 a.m. and say,
oh, they do.
I
need a mental health day. Yes. I have heard those.
Yeah, well, you're supposed to be there at 6.
Yes.
So, yeah. What do you think?
Do you feel we've covered foundations, our foundations, and started kind of foundations of nursing and how it's kind of your own responsibility to develop your own foundation? Because if your foundation, right, is not solid, then
you're going to crumble.
You're going to crumble. You're not going to be happy. You're not going to make this a lifelong career. You need a solid foundation. And it tends to start in nursing school where you learn these basic skills. You learn that nursing is a profession. You learn nursing ethics. So that, to me, that is where I always started with nursing foundations.
Yeah. And professionalism.
Yes. Yes.
And we'll talk about that too, dressing. We don't have a suit and tie that we wear, but our scrubs need to be clean and professional and covering all body parts and the like.
Right.
So we'll
no distractions. Yeah.
And functional. My goodness, I would keep alcohol pads and a tourniquet, and I've got my stethoscope,
salines, flushes,
scissors, and you'll learn to use those pockets and be prepared for the unexpected.
Whatever.
So efficient, effective. That's another thing that our goal is with some of the skills is you do have 10, maybe 15 patients that day, depending on where your facility is, and how are we going to get all them ready and up for breakfast before the breakfast is cold?
Right.
So
I got here at 7, and they got to be up in the therapeutic dining program at 8.
Yeah.
Right.
So we got to.
How do we do that?
How we do that safely, and
or you have to learn to organize your time.
Organization is a big thing.
Organizing your care
and involve your patient. Right. How can you help me? How can I help you? I need you to help me do this way, and they'll be much more compliant. Right. You don't want to wake them up at, okay, it's 7 o'clock, get out of bed.
No.
Oh, no, we're not going to do that.
No.
You're liable to get pinched, smacked, dirty words,
Whatever's within throwing.
That's it.
Grabbing distance.
That's it. So maybe your night shift people have helped you a little bit, and they've got them set up, and they're brushing their teeth before they get there.
Absolutely.
Teamwork,
Work that out with that team member from the previous or
your supervisor. Maybe y'all need to have certain tasks. These 6 people have to be up at a certain time, and your night shift is going to get the first part started, and you'll finish them up, and everybody will be on time and low stress to start your shift.
Yes.
Right.
Yes.
So communication, we'll talk about that. Giving report, effective reporting, reviewing care plans. If you're in a facility with care plans, again, everybody's individualized and they have certain things. So we're going to touch on all that stuff. We've got our little disclaimer here at the end, and look forward to seeing you for episode 2.
See you later.
Bye.
This podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other healthcare services, including the giving of medical advice, and no doctor/patient relationship is formed. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions.